we know that there have been hearings in the Senate, and there have been many complaints by our health workers with regard to their benefits. Okay? Now, for next year's budget, have we already appropriated the necessary benefits to be given to our health workers?
Mr. Chair,
Yes.
Your Honor, if Senator Recto is referring to the SRA, then it is not. But for hazard pay, it is because it is part of the salaries of our healthcare workers. For MAT, which is meals, allowances, and transportation, this is supposed to be charged against the regular budget of the agency.
So it is incomplete. We do not have adequate resources to provide our health workers next year.
For SRA, Your Honor, Mr. Chair, there are no sources in the budget at the moment for that specific allowance.
And how much will be needed?
I understand based on the computation of DOH, and this has not been verified because the number of healthcare workers have not been specified. But I understand roughly they're estimating 52 billion pesos.
Will
for
be
this
needed
purpose,
for
Your
next year. Okay, so
52
yun ang
billion.
kulang. Okay? I'm sure that
Para
the
sa ano
chairman-
yun, Yusek Tina, yung 52? For what
52
purpose?
billion.
For
Hindi pa
SRA?
namin
Is that
nako-compute
just for
yung-
SRA?
Yes, that is for SRA, Your Honor, Mr.
Okay,
Chair.
thank you.
Okay. SRA lang yan. What about other benefits due to healthcare workers aside from the SRA?
The MAT, Mr. Chairman, Your Honor, Senator Recto, the MAT is supposed to be for a 6-month period based on their submission, 32 billion pesos. But then again, we're not sure because they use this is a potential claim. I think there should be a lower and higher number where you compute how many actually of the healthcare workers will be entitled to the MAT.
Okay. And incidentally, magkano ba talaga yung SRA na yan? How
Ang
much is it?
maximum, Mr. Chairman, may I proceed?
Yeah.
The maximum of the SRA is 5,000 per healthcare worker per month. But there are categories which DOH policy has determined. So hindi po equivalent to 5,000 flat amount yung
It could be
SRA.
lower.
Yes, in all probability it might be lower.
On the average, how much is it? 3,000?
We are not sure, Your Honor, Mr. Chairman. What we do is whatever DOH submits to us times the number of healthcare workers we provide.
Okay.
So
So,
it is,
just for our
DOH
understanding, pinag-uusapan lang natin dito 3,000 o 5,000
Opo, Mr. Chair.
for our nurses and for our doctors. Is that correct?
Healthcare workers who are exposed directly. So there is a distinction pa po dahil hindi po lahat ng healthcare workers natin ma-entitle sa SRA. Because under the bayanihan,
I
ang
understand that.
nakalagay po yan.
Yusek Tina, we discussed that, no? And we can now amend that in the budget.
Yes po.
Okay? To include all. Okay? So, but the point is this, we're talking about our doctors, our nurses, at ang pinag-uusapan lang natin dito, 3,000 piso isang buwan hanggang 5. Buhay nila yung nakataya. So, napakaliit na halaga lang nito kung tutusin natin, And we're talking of a 5 trillion budget. And we're spending less on health next year than on this year. Okay, so that's the point I just wanted to bring out as well, no?